I'm Amanda Morrison.
I'm Lupe Hernandez.
I'm Roderick Richard.
I'm Julio Cesar Cervantes.
And I am Katie Lockie, and our proposition of policy is that the United States government should defund Planned Parenthood. The United States government should stop funding the health center Planned Parenthood. Planned Parenthood is a health center for women that has gained recognition for supplying abortions to women who have decided to discontinue their pregnancies. Planned Parenthood should not be funded as it is unnecessary, unethical, and immoral. The unnecessary costs Planned Parenthood has on the U.S. government is upwards of $500 million. Kurt Zubin of NPR has stated that totals more than 40% of Planned Parenthood's total $1.3 billion in revenue for the year. This money could be used on more important things in the government, such as helping with our $19 trillion debt, or even providing better sex education courses to public school students so that they don't have to end up at facilities like Planned Parenthood. It is quoted that Planned Parenthood is an independently wealthy organization. According to its latest annual report, it has over $1 billion in net assets. In 2014 alone, data shows that Planned Parenthood's revenue exceeded their expenses by over $90 million. If Planned Parenthood is an already wealthy program, then it would not require funding from the government to keep it going. There are already other options for women in terms of health centers and health care. You can go to a private physician, any other clinic, and there they can supply you with birth control, breast exams, pelvic exams, pap smears, anything it needs. And you can go there instead of having to go to an organization that is notorious for providing abortions. If Planned Parenthood was to stop being funded by the United States government, they would rely heavily on donors who believe in the mission. These donors would help the organization not have to go through lengthy government regulations, allowing women to have the same health care as a private physician without the need for high insurance coverage and costs.
Cecil Richards, president and CEO of Planned Parenthood Federation of America, was interviewed by Katie Kirk answering the accusations of selling aborted baby parts and body parts for profit. The Planned Parenthood CEO claims that the selling of aborted baby parts would be only used for life-saving medical research. Richards says that the money that was reimbursed to them was just to cover the cost of transporting materials and making sure that the labs had all they needed for the procedures. Stephen Erteld, writer of the article covering the CEO's interview, tells us that as top scientists have noted, the facts show neither necessity nor therapeutic when relying on aborted baby organs and tissues. In total, there has been 11 videos leaking the evidence that the Planned Parenthood clinics have been selling aborted baby parts. One of the most popular videos is the first one to ever be leaked. Dr. Deborah Nucatola of Planned Parenthood speaking so casually over baby crushing, which is what doctors must do in order to extract organs from within the dead body. The law specifically states that it is illegal to sell human body parts, therefore aspects of Planned Parenthood are in complete violation of federal law. There has been many cases of Planned Parenthood employees selling aborted baby parts, and in order for this unethical act to stop, Planned Parenthood must be defunded. Planned Parenthood's selling of aborted baby parts claimed to be for life medical research, but there has been no medical proof that these baby parts serve any real medical purpose.
So there have also been cases of abortion without proper regulations. Abortions have been performed with no real justifications. According to the Washington Times, an article by Valerie Richardson, there was this 13-year-old girl that went to a Planned Parenthood facility with her alleged stepfather and asked to have an abortion. Well, the staff of the facility didn't even ask this 13-year-old girl if she went through a sexual abuse or not, and they just gave her the paperwork, she signed it, and after she had the abortion, well, later on, after the abortion process, she confessed to her mother that she had a sexual abuse encounter with her stepfather, and this gained wide media attention because there have been many cases where young girls have become pregnant because of sexual abuse received by who received abortions and been returned to the abusers with no questions asked. So yeah, that's one thing to think about. And going on, most people are more really opposed to abortion, so they shouldn't be required to pay for things they don't agree with. As a nation, we shouldn't have to pay for other people's responsibilities because, first of all, these girls, they knew what they were doing. They knew about the consequences. So maybe they should have thought about it, like before having sex. They should have thought about it, like, maybe I should wear some protection because I don't want to have to go through abortion and kill my very own child, you know. So yeah, we shouldn't have to pay for abortions because we have other things to worry about.
Means that they provide services to everyone regardless of economic status. However, most of the services they provide end up in referrals to other facilities. Planned Parenthood does not have the proper equipment to perform one of the services that they claim they do, such as mammograms. That is one of the most important exams that many low-income women can't afford. If after the breast exam process they find something abnormal in the breast, they will proceed to refer the woman to other facilities that carry the proper equipment to perform an in-depth mammogram. According to Courtney Crandall, World Magazine states, out of the 487,000 breast exams that year, only about 14,000 led to mammogram referrals, a much smaller number than the 327,000 abortions performed that same year at Planned Parenthood. If you have no insurance, the price of certain exams will be high for many low-income women, and many will fail to get the exams done.
Any advocate for Planned Parenthood is going to be quick to notice that the majority of our arguments are based on the fact that abortions make up a large percent of what Planned Parenthood does. And they will also be quick to point out that according to Planned Parenthood, abortions only make up 3% of what they do. However, the statistic is extremely skewed. Although, yes, it is true that when accounting for all procedures equally, abortions make up 3% of what they do, not all procedures should be considered equally, especially when considered financially. Planned Parenthood uses the 3% statistic to defend its right to government funding, but abortions are only 3% of the services they provide, not 3% of the money that they spend. In order to arrive at the 3%, abortions are counted as one service, which can cost up to $1,500, according to the Planned Parenthood website. While emergency contraceptive pills, which only cost about $45, and urine pregnancy tests, which only cost about $10, are each only counted as one service as well. An additional error in the way they arrived at this statistic is that each service is counted, not each patient. If a woman comes in and receives STD testing, a pap smear, and birth control, she is counted 3 times. So if in one day this woman comes in and receives all 3 services and another woman comes in and just receives an abortion, on the records for that day it will look like only 25% of what they did that day was perform abortions, but in reality 50% of the women that came in received abortions. Rick Lowry, an op-ed writer for the New York Post, argued that the 3% statistic is crafted to obscure the reality of Planned Parenthood's business, and that such cracked reasoning could be used to obscure the purpose of any organization. Just to solidify this point, he made the analogy that Major League Baseball teams could say that they sell about 20 million hot dogs, but only play 2,430 games all season. So baseball is only 0.012% of what they do. When considering this analogy, the way Planned Parenthood counts their services sounds absolutely crazy. In conclusion, we have decided that although Planned Parenthood claims to be an easily accessible and largely beneficial program, throughout the course of this presentation we have proved that they do not do nearly as much as they claim to, and therefore allocating any amount of government money to the Planned Parenthood program is not only unnecessary but an unethical use of taxpayer dollars.